woken up, and I saw doctors and nurses putting an IV in my arm. I was in immense pain. I couldn't remember who I was or how I got there. When I arrived at the scene, I saw a man lying unconscious on the curbside of the road. Late last night I was driving my motorbike with a friend, when a car reversed suddenly and crushed us both. The first thing I did was make a compress to stop the bleeding on his face. I asked a bystander to help me carefully place the patient onto a backboard.
When he arrived, my staff and I provided an IV and medication. We then transported the man to the trauma ward.
I'm so thankful for the people who came to my aid when I was in critical condition.
Without MTI's training, most of the patients who get in the car accidents would die at the scene.
The perspective here hasn't been one of training. The perspective here has just been, we learned about ambulances indirectly through the media. And right now, unfortunately, if you get involved in even a relatively minor accident, there's no care given, and there's a possibility that you can bleed to death before arriving at the hospital. Now they're starting to understand that ambulance care is actually medical care that has started on the scene.
The training is really filling the gap in terms of what we need to know to treat patients correctly. Because of the knowledge provided by MTI, we're saving lives at this hospital.
I am extraordinarily pumped up every time I come to class because I see the excitement in the eyes of the Cambodians. I see the hunger that they have to learn more.
I would like to thank MTI. After receiving the training, I can see how lives are being saved. We use the knowledge, we use the skills, and we apply them in the field.
So the bottom line for MTI is that it is translating directly into professionals that can directly save lives.